Hi, and welcome to House Calls, Real Docs, Real Talk. I'm your host, Nancy J., filling in for Mercedes Fuller. I'm really happy to be back in the hosting seat and looking forward to hearing your questions on our grab bag of topics. From cholesterol to COVID, we're ready to answer your burning questions, so let's get started. With me this morning is Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. Welcome, Dr. Sanchez.
Hi, how are you?
Fine, thank you. I'm so glad to see you because we want to jump into today's discussion with health in the headlines. Of course, good health is always newsworthy. So each week we select one current headline that ties back to the topic at hand and ask our expert, in this case, Dr. Sanchez, to respond. Now, this week's entry is from Very Well Health. The title is The Warning Signs of Stroke in Women. They can be subtle. I don't like the sound of that, Dr. Sanchez. So full disclosure, though, here, sir. My mother had a stroke when she was 65. We weren't expecting this. It was a surprise. So hopefully you can add to this. I mean, we don't always know when a stroke is going to be happening, do we?
We do not know when a stroke is going to be happening. That is absolutely the case.
Okay, so what are the signs of a stroke that we may just ignore?
Well, the signs that we talk about are called FAST. And it's meant to be an acronym to remind us all of what it is that we need to know when we might need to act quickly. And FAST stands for facial drooping, arm weakness, difficulty with speech, sort of slurred, and the T is for it's time to call 911. And the truth is, if you're having any kind of signs or symptoms, that is things happening to you, those are fancy words for things that are happening to you that might be neurological, double vision that suddenly develops, or some inability to move your arm the way that you were used to moving. I believe that the prudent thing to do is think, in this case, worst case, hope best case, call 911, because as that headline says, the signs can be subtle. FAST are kind of the obvious ones: the facial drooping, arm or weakness in a leg, speech difficulties are way more obvious than some of the subtle signs. So anything that appears to you, or as you are watching someone else, to be a little bit different from usual, call 911.
Does age have anything to do with it?
Age has something to do with the likelihood that things can be strokes, because as we know, the risk of stroke increases with age. I will share as we talk the number one risk factor that can be modified, can't modify our age, is blood pressure. And so I do want to say that it's so critically important for all of us to have a sense of what our blood pressure is that high or not, and then connect with medical care, not only to address blood pressure, to address all the other risk factors that are associated with stroke. We like to think of those risk factors on some level as what we call at the American Heart Association, American Stroke Association, Life's Simple 7. And we can talk about those right now, or I can wait until a little bit later.
Well, why don't we just give us those 7 things right now, Dr.
Yeah,
Sanchez?
I thought I was just going to prompt you by saying it that way. So Life Simple 7 refers to 7 things. Now, let me be clear. It's simple to say them. It's not always easy to do them. But here are the things. 1, not smoking. 2, being regularly physically active. 3, eating a healthful diet. And we can go into detail on these in a moment. 4, having healthy weight or maintaining current weight. 5, blood pressure that is controlled. 6, cholesterol that is being managed. And 7 is knowing and then addressing blood glucose. If it's too high, do the things that are going to bring it lower. Sometimes that means taking medications.
Is a stroke hereditary? My mother had it at 65. I'm past that, thank goodness. But does that mean I am more likely to possibly have a stroke?
Family history is definitely a factor, but I like to say that your genetics might predispose you, but if you can do those Life Simple 7, you can reduce even that risk with predisposition substantially and protect yourself from having a stroke. And that's the sort of thing that ought to be discussed with your doctor. I think one thing that's really important for us to say here, and I'm going to say it over and over, it is so important to have a relationship with a clinician, a primary care doc, a primary care team, your cardiologist, your neurologist, because there are a host of things that ought to be addressed periodically and regularly, just to make sure that as we live our lives, as we age, we are paying attention to, being reminded of those Life Simple 7 and making the adjustments that need to be made, sometimes around how we live our lives and sometimes around the medications that we are on.
Okay, well, I know our listeners and I are counting. I'm like, I think I've got 5 of the 7. Okay, so I can work on the other 2. But right now, Dr. Sanchez, let's get into our main segment to answer viewer questions in You Ask, We Answer. And just a reminder, today's topic is an open forum addressing any possible medical issue. You ready, Dr. Sanchez?
I think I'm ready. That noise sounded like a quiz show, so I am ready to answer questions.
Okay, well, yeah, we won't have the answer up. We're going to ask the question as opposed to the other way around. So no jeopardy here. Our first question comes to us from Brody in Hyannisport, Massachusetts. I recently had a heart attack. Is it safe for me to exercise? Dr. Sanchez.
That's a great question. I probably would want a few more specifics, but in general, physical activity is a great thing to begin to do gradually and under the care of a doc to begin after you've had a heart attack. Absolutely. And I say in general, there may be some specific circumstances where maybe that's not the best idea right away. But cardiac rehab is something that ought to have been offered and made available to that person, to you. And yes, physical activity, one of Life Simple 7, is not only a way to prevent a first heart attack and to promote cardiovascular health, but it is also a way for folks who've had heart attacks, who've had strokes, to reestablish a level of cardiovascular health that will protect them from having a second heart attack or a second stroke. So the simple answer is yes, but the nuance is, in your particular case, really important, as I said before, to be connected with your clinical care team so you can understand what are the things that you ought to do and at what pace and what you should be looking out for.
Ah, got it. So let's go now to Hooper from Newport, Rhode Island, and asking, why is it a good idea to monitor my blood pressure at home?
Well, it's a good idea to monitor your blood pressure at home because that's a place where you are probably there every single day. It's a way to regularize a pattern for checking your blood pressure. But let's put this in context again. I mentioned a little earlier that high blood pressure is the #1 risk factor, controllable risk factor for having a stroke. It is also a leading, if not the leading risk factor for having a heart attack. So adults ought to know what their blood pressure is and then ought to do what needs to be done to bring that blood pressure level to a level that will reduce the risk of bad things happening. And it's not just heart attacks and it's not just strokes. High blood pressure affects your kidneys. High blood pressure affects other parts of your body.
How do you know, though, which blood pressure to go with? Because one day it might be different from the next or 1 hour to the next.
That's a really great question. So yes, our blood pressure fluctuates. It changes throughout the day based on things that might be happening. If you're shoveling snow at this time of year, your blood pressure may be higher than if you're just chilling and watching somebody shoveling snow on the TV on a news story. Your blood pressure might be high after having heard some really, really unfortunate news or really exciting news, as compared to, again, if you're just sitting around and chilling and meditating. However, there are protocols for checking blood pressure, and those protocols are to help clinicians figure out whether your blood pressure is generally controlled when you're at home or not. If your blood pressure is high and you're concerned, I think those are things that, again, because you're in a relationship with a clinical care team, you might share that with the doctor and determine whether in that particular case, if that is a meaningful fluctuation or not a meaningful fluctuation. But in general, the protocol for blood pressure monitoring and measurement at home is to take your blood pressure 2 times separated by 5 minutes in the morning, 2 times separated by 5 minutes at night for 3 to 7 days in a row. And then the average of the systolic blood pressure, that's the top number, and the average of the diastolic blood pressure, that's the bottom number. That number, the average of the top and the bottom, are representative of what your blood pressure control is at home.
Thank you for that, doctor, because I know most of us get our blood pressure is higher when we go into the doctor to have it checked, probably,
So,
right?
and actually, it's so great that you mentioned that, because that is a known syndrome. It's called white coat hypertension. And so one of the reasons that home blood pressure monitoring is so important, I think this is an important thing for viewers to hear, is that that home blood pressure is meant to try to reflect what really might be going on, because that blood pressure in the office may be elevated because you have white coat hypertension. And in fact, the recommendation to doctors is if you, for example, were to come in and say, oh, I was at my local pharmacy and at the kiosk and I checked my blood pressure and it was elevated. One of the ways that we confirm that, because no doctor is going to take action based on one single blood pressure reading, is to provide you a home blood pressure monitor, either that you borrow or you buy, and then you follow that protocol to confirm elevated blood pressure, or just establish maybe you also had a white coat hypertension version because you were at the kiosk at the pharmacy.
Okay, great information. Now, here's one from Chrissy. She writes, my doctor said my cholesterol is high. What steps can I take besides medicine to help lower my cholesterol? Should I consider medication? Answer, Christy. Here you go.
Yeah, so medication may be in the cards. And there's 2 things that will inform the discussion that ought to be had between you and your doctor about whether or not you should be on cholesterol lowering medications. And not only the level of your cholesterol, but there's something kind of complicated. I'm going to tell you in advance, lots of letters and lots of multisyllabic words, and then I'll explain it. And that's the atherosclerotic cardiovascular disease risk estimator. And what that is it's a program, a formula, if you will, excuse me, that helps determine whether a person is at risk of having a bad thing happen to them in the future. Bad thing, a major adverse cardiac event. And major adverse cardiac events include heart attack, stroke, having to have a procedure because you're about to have a heart attack and or a stroke. And these are based on a number of observational studies and data that correlate a certain set of factors with those certain kinds of outcomes. And so the recommendation for clinicians, primary care docs, cardiologists, and others is to, in assessing a person's cardiovascular health, apply the ASCVD risk estimator, and then determine if a person's risk is above a certain level or not. And if it is above a certain level, you and your doc should have a conversation. I'm not going to go into the details because I'm just going to bore you with numbers, but you can search ASCVD risk estimator and actually do it for yourself, see where you fall and determine whether it's time to go talk to your doctor about where your risk is. Now, that other part of the question was, are there other things that I can do besides medications? Eating a heart healthy diet is one way to help with cholesterol lowering. A heart healthy diet is a diet that includes probably more fruits and vegetables than you eat now. Could be and maybe should be as much as 50% of what you put on a plate. Includes what are called mixed carbohydrates, or you might call them whole grains, and includes lean proteins with probably more plant proteins than you eat today. And if you were to ask yourself, what is a plant protein? Beans are plant proteins. They're in the category called legumes, and nuts offer some plant protein. And one of the interesting factoids for today is that peanuts are not nuts. They are legumes. They are in the bean family, not in the nut family. Go figure.
Yay for peanuts. I like that. So now, Dr. Sanchez, we're going to change the topics here for just a minute. Quint asks, my daughter is pregnant. Congratulations, Quint. Is it safe for her to get the COVID-19 vaccine?
In general, for most people, getting a COVID-19 vaccine is very, very safe. And again, if your daughter's pregnant, then she should be under the care of a doc. And any concerns that you might have about COVID-19 vaccine, you should have that conversation with the doctor who's providing care for your daughter.
Okay, here's one from Lorraine in Gary. My doctor said I have atrial fibrillation. Did I say that right? What is this and why should I be worried about it?
You said it right. And atrial fibrillation is a condition where a part of the heart, the atrium, the left atrium, is that's the part of your heart that triggers the rest of the heartbeat. So it is sort of the if you wanted to think of it as it is the first of a series of things that happen that constitute the full action of a heartbeat. Atrial fibrillation is when that firing is happening in a what's called irregular way. So if your atrium was firing really, really, really fast, and that can happen, that's called tachycardia, that drives tachycardia. That's a regular speed up of your heart. But if it's happening irregularly and in an irregular way, that is what atrial fibrillation is. Sometimes it could happen very fast. Sometimes it happens not so fast. It is a condition that needs to be addressed. And if your doctor told you you had atrial fibrillation, you also had a discussion about what are the things that you are doing to address them. Sometimes that's done using medications. Sometimes that's done doing what's called ablation therapy. So that's a procedure where you go into a you'll be in a operating room kind of setting, and electrophysiologists will do some things to try to keep that part of your heart from doing that beating. There's also sometimes what's called cardioversion is used. And that's trying to kind of reset the beating of your heart. So atrial fibrillation is a very serious thing, ought to be addressed. You ought to talk to your doctor, should have already been talking to you about what might be the next steps to take care of your atrial fibrillation. One other thing is if you have atrial fibrillation, you will probably be on a lifetime of anticoagulants because atrial fibrillation is another risk factor for stroke. It causes the irregular beats can cause clots to be kind of displaced from particularly the heart. They can go into your brain, lodge in parts of your brain, cause a stroke. So atrial fibrillation is usually treated along with trying to address the rhythm issue with anticoagulants.
Okay, Dr. Sanchez, that's a good answer, of course, something to really have to think about. But here's another good one from Larry. He's in Amityville, New York, wondering, I've heard that eggs aren't good for your health. Is this true? Eggs are bad for us?
No, eggs are okay. There was a time where we were very, very worried about limiting the amount of eggs that we eat. I would say, though, let me come back and say a diet that is, 10 eggs a day, 3 times a day, probably not a good idea. But a dietary pattern that includes eggs in a moderate way, in a well-balanced, fruit and vegetable heavy, whole grains, including, and lean animal proteins is very okay.
But
So
isn't it the yolk? Isn't it the yolk that has the cholesterol?
it may be the yolk that has the cholesterol, but the truth is, again, in moderation, it's okay. But just like anything else, too much of anything is a little too much of anything. And so if we lean into fruits and vegetables, lean into the complex carbohydrates, the whole grains, and lean into plant-based animal proteins more than now, you are generally going to be okay. And I would say, yet again, we're just talking here in general. It's okay. In general, the way most people consume eggs is all right. If you have a particular concern or particular issue, I encourage you to connect with your clinical care doc. That's always going to be the default answer, because not everything can be covered in house calls.
Okay. Moderation is the key. So here's from Bruce from Martha's Vineyard. He's curious about, this is a little different now, any updates you might have on the COVID booster shots for children.
I'm a subscriber to the science of public health and science in general. And so I will say, because things change, that the recommendations that are made by the Advisory Committee on Immunization Practices are based on very, very rigorous review of very, very rigorous and robust science. And I have every confidence that those recommendations should be followed. They will result in best health for all individuals and the population. So depending on where the recommendation is right now, if the CDC is saying it's good, do it. If the CDC is not yet saying anything about it, hold off until you get a recommendation from the CDC and A-Fib. That's
Okay.
the Advisory Committee on Immunization Practices.
Okay. Well, our last question, Dr. Sanchez, comes from Stephen. What is the best mask to wear to prevent COVID infection?
Yeah, the best mask to wear is an N95 mask. The KN95s are purportedly just as good, but what we have learned is that there are some not so good ones in the marketplace. The KN94 masks, which come from Korea, have a better quality control about what's in the marketplace. And so I would say to you, N95 if you can get it, KN94 if you can't get an N95, and be careful, judicious about about the KN95 mask. So the kind of mask does make a difference. Having said that, when it is a good idea to wear masks, and that might be if you're in indoor spaces where there's a lot of COVID-19 activity at the community level going on with people, particularly that you don't know and can't separate yourself from, wearing a mask is a good idea. Whatever you have is better than no mask. But let me finish by saying N95 is the best, KN94 is second best, and KN95s, only because of the variation in the marketplace, just be careful about where you get it, the quality control that where you get it is using, and those are better than surgical masks, are better than cloth masks, are better than no mask.
Or even one of those cloth masks with the filter that goes in it that you can change?
That's better than no mask.
Okay.
I still would say the N95 is the best. And then there's this, there's the hierarchy of quality of masks.
It's kind of like a
having 2 layers is better than having only 1 layer in general.
Okay, Dr. Sanchez, thank you for playing 20 questions with us today. As always, you are the best resource on so many health topics. So thank you so much. Now, I did notice that a lot of our questions were about COVID, even 2 years into this pandemic. Dr. Sanchez, do you think 2022 will provide any relief?
Well, I think 2022 is already providing relief because we do have vaccines. They are very, very effective in keeping us out of hospitals and keeping us from having really, really severe COVID. So I really do think 2022 is going to be way better than 2021 and 2020. 2021, the vaccines were available, but we were just beginning the ramp up. There's a fair percentage of people who are vaccinated. I would encourage anyone who's watching and isn't yet fully vaccinated and boosted according to the recommendations by age, by the CDC. Do that. Get yourself vaccinated. You will be affording yourself and those around you the maximum protection that's available right now. I think the other thing is what we've learned is we've got to always be aware of what's going on and aware of what's happening where we are. And that's probably another good thing. We're a little less complacent and a little bit more aware, and that's not a bad thing.
If anyone had told you, Dr. Sanchez, that 2 years later, like if we're back in 2020, that we were still dealing with this, would you be surprised?
I would be lying if I said I wouldn't be surprised. But as I reflect on having read about the 1918 flu pandemic, I would say that when I take that into account, I'm not surprised. I'm a little surprised that we can't remind ourselves that A, took a really long time. B, it was a pandemic. It's hard to make that the guide of everything we would do because it was one pandemic. But it does remind us that things didn't just settle into the dust and go away. There were some periods of a bit of resurgence and the need to pay attention to what was going on. Again, I think the really critically important thing to say that's different between now and then is more the fact that we have vaccines. We have a better way of knowing what is going on day to day, week to week than we did, 100 years ago.
Dr. Sanchez, thank you so much for your time. So much to think about, and we all really, really appreciate it. I'll be watching this one a lot. I like the information. Thank you.
Well, thank you for having me.
And how about that? Does it for our show. You can find any of our previous shows in the House Calls playlist right here on YouTube. So please consider subscribing to find more content like what you just watched, and the fact that you can watch it over and over and over again. Take some notes. Mercedes will return for our show next week, and I do hope to see you all again soon. Until then, please take care of yourselves and, of course, each other. I'm Nancy J.
Getting back to this, to her, to family, to friends, to hugs. For people at higher risk of COVID-19 complications because of diabetes, high blood pressure, and heart conditions, the COVID-19 vaccine is an important choice. Consider it's the first step towards getting back to what you miss so much safely. Getting back to life. Set your heart on it. It's up to you. A message from the American Heart Association.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.